And audible to all of you. Please confirm this if I'm visible and audible so that we can quickly start with this topic. Hello everyone, good afternoon, very good afternoon to everybody here. I hope I'm visible and audible. Yeah, so I think I'm visible and audible now. Thank you so much. Thank you so much for confirming this. Good afternoon to all of you. We're going to be starting this in next 2 minutes. Let people quickly join and see. So this is quite an important topic. Please make notes for the Medical Termination of Pregnancy Amendment Act 21. अभी recently ये जो rules है या फिर जो नए amendments है, it has been notified by the government. So what are the changes that has been brought is something I'm going to be discussing. And after that, I have some quiz questions also for you at the end. So we're going to be doing those quiz questions as well at the end of this particular. I would say when we complete the topic, we'll do some quiz questions also. So starting this in 2 minutes, okay? Just wait for 2 minutes so that we can quickly start after that. So I had done this topic earlier with the previous batch, but there are certain changes also that we'll be discussing today. Hello guys, good afternoon. I hope now your preparation is a little bit on the line and you guys did the mock test yesterday. Mock test mein I think most of you could do better than the other mock tests that you guys have done so far, which is a good sign. Very good afternoon. Very good afternoon. Good to see you all here again. I am doing better now. Thank you so much for asking. 3 बार से सेम मॉक टेस्ट में स्कोर आ रहा है. दैट्स ओके. इफ इट्स नॉट गोइंग डाउन इट्स फाइन. ऊपर कर लेंगे धीरे धीरे. ठीक है. इट शुड नॉट गो डाउन अब से. ठीक है. प्रीवियस 6 months से ट्राई टू डू इट थ्रू आवर सेशंस, थ्रू द कंपेंडियम्स. जो पहला जो छूट गया वो कंपेंडियम्स और सेशन से कर लो. बट आई वुड सजेस्ट कि जितनी क्लासेस देख सको पुरानी भी देख लो, बिकॉज वी हैव classes almost at the same time every day, so you can do that. Okay. So let's begin with this particular session. So guys, today's topic is Medical Termination of Pregnancy Amendment Act. This particular act has come in 2021 itself. तो हम डिस्कस करेंगे कि ये क्या एक्ट है, क्या चेंजेस आए हैं, एंड मेडिकल टर्मिनेशन ऑफ प्रेगनेंसी इन वेरी नॉर्मल वेरी सिंपल टर्म्स इज कॉल्ड अबॉर्शन. तो अबॉर्शन पर इंडिया में क्या लॉ है, क्या चेंजेस आए हैं, वो डिस्कस करने वाले हैं आज हम. ठीक है. इन वेरी सिंपल टर्म्स इट्स कॉल्ड अबॉर्शन. सो हम डिस्कस करेंगे कि व्हाट इज द लॉ ऑन अबॉर्शन इन इंडिया. दैट इज समथिंग दैट्स अवर एजेंडा टुडे. So starting now. First of all, let me tell you guys, we'll be starting this new batch from 27th of October. It's called Law Masters. It's for CLAT 22 aspirants. Okay, Law Masters is going to be for CLAT 22 aspirants. I'm also one of the educators in this batch. You can join this batch. You can use my code Keshav Live to get 10% off on this one. ठीक है. Keshav Live use करके आपको इस पर 10% off मिल जाएगा. You can avail this batch because we roughly have 6.5 months left now. So these are batches that are going to help you quite a lot in covering your syllabus and be CLAT ready. Other than that, I think you would know that we have been doing a lot of special classes on Unacademy, and these special classes are absolutely free of cost. The 9:15 class that we do every day आज भी हम करेंगे, ठीक है? So these are free classes, और इसमें एक नया फीचर है where you can speak to your educator. It's called raise a hand, where you can speak to your educator and ask doubts verbally. और अगर आप इसके ऊपर एक प्लस सब्सक्रिप्शन ले लेते हो, that will be your complete guide for your CLAT preparation. Right? Go and check the description box for the link. ठीक है? Even if you want to take it or you are considering to take it, आप एक बार link check कर लो. Look at the prices if it suits you. Keshav Live code रहेगा. You can use this code to get 10% off also on those prices जो आपको link पर मिलेंगे. Okay? हाँ, NDPS is tomorrow on YT. NDPS Aryan Khan case we'll do tomorrow on YT. Other than that, for CLAT 23 aspirants, there is another batch starting called Law Tigers. Law Tigers starts on 29th of October. ठीक है, आप ये वाला particular batch भी join कर सकते हो from 29th October if you are looking to take a head start in your CLAT preparation. मेरा code है Keshav Live to get 10% off on this batch also. आप ये वाला batch भी join कर सकते हो using my code Keshav Live. Now moving ahead, guys, those who are joining me for the first time, welcome to my class. This is Keshav Malpani. I graduated last year from NLU Jodhpur. Current affairs, legal reasoning, data interpretation and strategy making is something I discuss on Unacademy on a daily basis, and Keshav Live is my code. ठीक है? Keshav Live is my code to get 10% off on all the courses on Unacademy. Okay? So starting with this now. So guys, देखो शुरू में क्या होता था? Initially when we did not have a proper act to govern this, abortion was illegal in India. ठीक है? Abortion was not legal in India till 1971. It was actually governed by the Indian Penal Code. So section 45 of the Indian Penal Code used to ban abortion in India या medical termination of pregnancy. It was illegal before 1971. And कैसे illegal था? It came under section 45 of the Indian Penal Code, which said that it is going to be illegal. है ना? Abortion was not recognized by the Indian law till 1971. उसके बाद में there was a need to enact a law to regulate abortions in India, because क्या होता है? See, abortion is not just because you don't need a child. There are a lot of ways where people might need abortions, right? For example, let's take a very common example from India is of a rape victim, right? She might get pregnant and she might want to abort the child. But if there are no abortion laws in India, she will have to give birth to the child and take care of that child, right? Which is quite problematic. That is why abortion, a law on abortion, a law regulating abortion is very important for any country, है ना? So इसीलिए 1971 में the government came up with this act called the Medical Termination of Pregnancy Act of 1971, which legalized abortion in India. It said abortion is allowed, but ऐसा नहीं है कि आप कभी भी abortion कर लो. You are not allowed to do it at your whims and fancies. There were certain rules made, there were certain restrictions made to it, wherein women can undergo abortion. Okay? तो section 3 clause 2 clause A बोलता है, a pregnancy may be terminated by a registered medical practitioner where the length of pregnancy does not exceed 12 weeks. ठीक है? अगर 12 weeks तक उनकी प्रेगनेंसी उससे आगे नहीं बढ़ेगी, अगर 12 वीक्स तक की प्रेगनेंसी है तो वो उनको अबॉर्ट करवा सकती है. द वुमेन कैन गेट द फीटस अबॉर्टेड इफ द प्रेगनेंसी इज नॉट बियॉन्ड 12 वीक्स. अब कई बार क्या होता था, 12 वीक्स इज रफली 2.5 to 3 months, है ना? कई बार क्या होता था, पीपल यूज टू गेट टू नो अबाउट देयर प्रेगनेंसी आफ्टर दैट, है ना? अ लॉट ऑफ टाइम्स दे यूज टू गेट टू नो अबाउट इट आफ्टर दैट, उनको पता ही नहीं होता था पहले. So that created some issues, है ना? कि मतलब 12 weeks is very less a time. For example, say there is a minor, ठीक है? A minor rape victim again, let's talk about it. So she may not go home and tell because she may not know as to what has happened with her. And if she gets pregnant, her parents used to come to know about it a little later. ठीक है? उसके पेरेंट्स को काफी लेट पता चलता था और 12 हफ्ते निकल जाया करते थे तब तक. And since 12 weeks was a very short period of time, there was a need that we increase this time limit, right? सिर्फ 12 weeks was a very short period of time and there was a need कि ज्यादा time करा जाए, है ना? More time is given. ये need felt हुई after this law came into being. Now section 3 clause 2 क्या बोलता था? A pregnancy may be terminated by a registered medical practitioner where the length of the pregnancy exceeds 12 weeks but does not exceed 20 weeks. Now understand this, 12 weeks तक तो normally one medical practitioner can terminate a pregnancy. एक दूसरा प्रोविजन था जिसमें 12 to 20 वीक्स तक भी कर सकते थे, बट दैट नीडेड 2 रजिस्टर्ड मेडिकल प्रैक्टिशनर्स. 2 रजिस्टर्ड मेडिकल प्रैक्टिशनर चाहिए उसके लिए टू डू दैट. उनका कंसेंट चाहिए, बेसिकली 2 मेडिकल प्रैक्टिशनर्स का कंसेंट चाहिए इफ योर प्रेगनेंसी इज बिटवीन 12 to 20 वीक्स एंड दिस वाज द मैक्सिमम टाइम फ्रेम. मतलब 20 वीक्स वाज द मैक्सिमम टाइम फ्रेम जिसमें हो सकता था. बट ये जो 20 वीक्स वाला टाइम फ्रेम था ना, 12 to 20 वाला, दैट वाज ओनली इन एक्सेप्शनल केसेस. नॉट एवरी केस फेल अंडर इट. इट वाज ओनली इन सर्टेन एक्सेप्शनल केसेस की अलाउ किया जाता था, अदरवाइज इट वाज जनरली नॉट अलाउड एट ऑल. Okay, so the pregnancy can be terminated if registered medical practitioner is of the opinion that continuance of pregnancy would risk the life of pregnant woman or of grave injury to her physical or mental health. पहला पॉइंट है ये बहुत इंपॉर्टेंट है सारे पॉइंट्स, तो प्लीज नोट डाउन कर लेना इनको. अगर मेडिकल प्रैक्टिशनर्स को ऐसा लगता है कि प्रेगनेंसी रखने की वजह से द विमेन लाइफ माइट बी एट रिस्क, ठीक है, जो लेडी है, the lady that is pregnant, अगर उनका life is at risk, then that medical practitioner can provide or they can allow for aborting the child, ठीक है, to basically terminate the pregnancy. So this is the first point and under which pregnancy can be terminated. Second point is that there is a substantial risk to the child that is being born, ठीक है, मतलब it is clearly known पहले से ही कि if the child is born there is a substantial risk to his health or to her health, that the child will suffer from physical or mental abnormalities as to be seriously handicapped. So nobody obviously would like to give birth to a child अगर उनको पहले से पता हो that it could lead to certain physical or mental abnormalities, right? In that case they would want to abort the child, and this I would say kind of chance was given, है ना? This I would say this was allowed under the act called the Medical Termination of Pregnancy Act 1971, and the medical practitioners will take a decision with respect to it. Obviously they will ask the mother if she wants to adopt or not. Her consent was the most important part in this, but if she wants to do it, it is the medical practitioner who will decide it and not just the mother. Okay, I hope it's clear so far यहाँ तक. Has everybody written these points down? Okay. So अब देखो, if a pregnant woman is below the age of 18 years, then to terminate her pregnancy, consent of her parents and guardians must be taken. ठीक है, अगर 18 साल से छोटी है, if the girl is less than 18 years of age and she has gotten pregnant, ठीक है, तो you need the permission of any parent. मतलब it need not only be your mother, your parents consent is required, ठीक है, any parents consent would work अगर the girl is less than 18 years of age, ठीक है. हाँ, और अगर वो 18 से प्लस है, if she is 18 plus, then her consent is must, her consent is compulsory, even if her parents say that we want to terminate her pregnancy and she says कि नहीं, she does not want to do it, ठीक है. अगर कोई कहता है कि 18 plus है लड़की and her parents wants to terminate her pregnancy or anybody else wants to terminate her pregnancy and she says कि नहीं, I want to give birth to the child, then she has all the right to do that, ठीक है, because her consent is must for terminating the pregnancy. If she is not giving the consent for termination, then the child cannot be terminated at all, ठीक है, then the fetus cannot be terminated at all. She will have the right to give birth to a child. Okay. Or where can abortion and termination of pregnancy happen? only a hospital established or maintained by government or a place for the time being approved for the purpose of this act by the government is allowed to terminate a pregnancy. Only the government hospitals are allowed. Okay, only the government hospitals are allowed. Hospitals which are either established by the government or maintained by the government, और जो गवर्नमेंट बताएगी कि मतलब इन जगहों पर, ठीक है. Okay, is there still a lag? I think it's better now. Is it still a lag? Okay, am I audible now, guys? Is there still a lag? ओके, थैंक यू. सो ये सिर्फ गवर्नमेंट हॉस्पिटल्स में हो सकता है, ठीक है. ये सिर्फ गवर्नमेंट हॉस्पिटल में हो सकता है. सो इट कैन ओनली बी डन बाय द एक्ट ऑफ द गवर्नमेंट, ठीक है. I mean by the hospitals that are established by the act of the government. So if the termination of pregnancy is carried out in a place other than mentioned above, it will be considered illegal. तो अगर प्राइवेट हॉस्पिटल्स में अगर ऐसा होता है, if private hospitals help you undergo abortions, then it is illegal. Okay. And not only the hospitals are liable, but the person who is going to a private hospital to get abortion is also liable. ठीक है. तो हॉस्पिटल के साथ साथ आप खुद भी लायबल हो जाते हो. इफ यू आर गोइंग टू गेट अ प्रेगनेंसी टर्मिनेटेड इन अ प्राइवेट हॉस्पिटल, इट इज नॉट अलाउड. ओके. So these are certain points that are important. If you're 18, if you're less than 18 years, then your parents or guardians' consent is required. If you're 18 plus, then the consent of the lady who is pregnant is required. A hospital which is established by the government is required for carrying out termination of pregnancy. If it is done by any other institution, then it is illegal. ठीक है. Now, anytime during a pregnancy, a doctor can terminate the pregnancy of a woman if it is immediately necessary to save the life of a pregnant woman. ये एक exception है. ये एक एक्सेप्शन है. इसमें वो मैक्सिमम 20 वीक्स वाला अप्लाई नहीं होता. वो मैक्सिमम 20 वीक्स वाला जो पॉइंट है ना, दैट डज नॉट अप्लाई इन इट. दिस इज एन एक्सेप्शन. कि अगर मान लो कोई ऐसी सिचुएशन है वेर इन द लेडी वुड डाई, बिकॉज हमने ना बहुत सारी कंट्रीज में देखा है. आई एम प्रीटी श्योर कि आप लोगों ने भी कभी सुना होगा अबाउट दिस न्यूज. यू मस्ट हैव हर्ड इन अ लॉट ऑफ कंट्रीज कि द लेडी डाइड बिकॉज देयर वर नो अबॉर्शन लॉज. ठीक है. समटाइम्स द लेडी डाइज बिकॉज अबॉर्शन लॉज इन यूएस कंट्री में. सो इफ द लेडी इज इन सच अ सिचुएशन wherein if the birth is given to a child, then she will definitely die. ठीक है. There is no other way to save her life than to abort the child. ठीक है. Child को abort करना is the only way. Then in that case, this particular woman can undergo abortion. ठीक है. Doctors can terminate her pregnancy in that case. ठीक है. हाँ, प्राइवेट हॉस्पिटल्स में इट्स इलीगल. प्राइवेट हॉस्पिटल्स में इट्स नॉट अलाउड. ठीक है. अ डॉक्टर whenever mentioned in the act must be a registered medical practitioner with experience or training in gynecology or obstetrics. So these are the two fields that are related to child's health and mother's health. So जो भी डॉक्टर होता है, जो भी मेडिकल प्रैक्टिशनर होता है, इट मस्ट बी अ रजिस्टर्ड मेडिकल प्रैक्टिशनर, अ रजिस्टर्ड गायनोकोलॉजिस्ट और ऑब्स्टेट्रिशियन. दिस इज कंपल्सरी, मतलब ऐसा नहीं है कि नॉर्मल कोई फिजिशियन हो गया या फिर कोई सर्जन हो गया. You have to be a practitioner in your own field. You have to be a gynecologist or an obstetrician. ये प्लीज नोट कर लो. आई होप आई एम विजिबल एंड ऑडिबल नाउ, राइट? मतलब अब तो लैग नहीं हो रहा है ना? इज इट स्टिल लैगिंग? थोड़ा बहुत आई अंडरस्टैंड, बट इज लाइक स्टिल लैगिंग अ लॉट. Can someone please confirm so that we can keep going with the class? Okay. ठीक है, अब कंसर्न्स क्या थे देख लेते हैं. ठीक है, अब क्या हो रहा है, 1971 में ये एक्ट आया था. नाउ वी आर इन 2021, है ना? दिस एक्ट केम इन 1971, वी आर इन 2021. सो द 50 साल पुराना एक्ट डज नॉट कोप अप विद टाइम नाउ. इट डज नॉट कोप अप विद टाइम बिकॉज दिस एक्ट हैज बिकम अ लिटिल ओल्ड. ठीक है, इट हैज बिकम अ लिटिल ओल्ड. अभी भी देख लो, जैसे मैंने आपको बताया, ओनली गवर्नमेंट हॉस्पिटल्स आर अलाउड टू प्रोवाइड अबॉर्शन फैसिलिटीज, अदरवाइज नोबडी कैन डू इट. बट इंडिया में कुछ रिपोर्ट ऐसा बोलती है कि अप्रोक्सीमेटली 80% ऑफ द अबॉर्शंस अकर्स इन इंडिया आउटसाइड द हेल्थ फैसिलिटीज. ठीक है, हेल्थ फैसिलिटीज के बाहर होती है, मतलब इधर दे हैपनिंग इन प्राइवेट हॉस्पिटल्स और आउटसाइड प्राइवेट हॉस्पिटल्स. ठीक है, तो ऐसा नहीं हो रहा है, मतलब द लॉ इज नॉट बीइंग फॉलोड क्लियरली. ठीक है, unsafe abortions is the third leading cause of maternal deaths in India. 10 to 13 women die every day as a result of unsafe abortions in India. Now this is a very big number. ठीक है, at least 10 to 13 women are dying just because उनका unsafe abortion किया जा रहा है इंडिया में. And it's not unsafe का मतलब ये नहीं कि forcefully किया जा रहा है. यहाँ पर ये मतलब है कि ढंग से नहीं किया जा रहा है. ठीक है, you are not consulting a proper medical practitioner for the same. Okay, you are not able to do it properly, and that is leading to death of a lot of women in India every year. In fact, every day 10 to 13 women are dying every day, which is quite problematic. ठीक है, so many women were approaching court to seek the approval of abortion over 20 weeks also. बहुत सारी women चाहती थी that they want approval to abort their child over 20 weeks, because see, people feel that it is their right, since they have given since they've conceived the child, they have the right to not give birth to a child as well, right? To kill the child when the child is a, I would say kind of, you could call it a fetus. ठीक है, when the child is a fetus and not a developed child in itself. Okay, so most of these pleas are due to fetal anomalies that are detected late, or case of sexual assault and rape, particularly of minors. As I told you, when there is a minor rape wala case, right, parents come to know after a very long time, when particularly you get a bump, you get a baby bump, उस टाइम में समझ में आता है कि there is something wrong. उससे पहले समझ ही नहीं आता, because minor is not able to tell the parents, and minor sometimes herself does not understand the act that has happened with her. So since a lot of minors are under an impression that okay, something happened, but it's fine, they do not tell their parents, and parents come to know about it at a very later stage, and at that stage it becomes very difficult for the parents to get the pregnancy aborted or to get it terminated. इसीलिए कई पेरेंट्स का ऐसा मानना था, कई लोगों का जनरली भी ऐसा मानना था कि 20 वीक्स से ऊपर का टाइम देना चाहिए. वी नीड मोर टाइम, मोर देन 20 वीक्स इज रिक्वायर्ड. ओके, क्लियर है यहां तक? Okay. Now, in many fetal abnormalities can only be detected after 20 weeks. As I already told you, कई ऐसी abnormalities थी जो 20 वीक के बाद पता चलती थी. ठीक है, so there was ambiguity around the provisions of the act for unmarried women to terminate pregnancy due to contraceptive failure. Now see, there are a lot of people who undergo sexual intercourse with particular protection. right? But obviously there are certain protection is not 100% successful, so there are certain contraceptive failures as well, correct? And in India, if a woman who is unmarried and she gets pregnant, there is a lot of stigma attached to it. Okay, there's a lot of stigma attached to it for having non-marital pregnancy or birth. If you are not married and you're giving birth to a child, there's a lot of social stigma attached to it, right? And that creates issues. So contraceptive failures creates issues sometimes, and people do not know that contraceptive has failed unless you come to know that you become pregnant. Okay, there is no way to know about it. So for pregnancy about 12 weeks, the consent of two registered medical practitioners is required. Okay, two registered medical practitioner consent is required. This is challenging in rural areas where single registered practitioner is also rare. You can't find a gynecologist in a rural area. It is very difficult to find one, right? तो यहाँ पर दिक्कत ये है कि अगर 12 वीक से ऊपर की प्रेगनेंसी हो तो दो मेडिकल प्रैक्टिशनर्स की कंसेंट की रिक्वायरमेंट है. But in rural areas, you can't find even one. How will you find two? Right? It is very difficult to find two gynecologists or two obstetricians in a particular rural area. So यहाँ पर practical problems थी कुछ act के साथ में, है ना? इसीलिए changes लाने की जरूरत थी because the 1971 act became impractical in a lot of aspects. ठीक है, काफी सारे aspects में it became impractical. Therefore, वो 12 वीक की प्रेगनेंसी के बाद जो दो मेडिकल प्रैक्टिशनर की रिक्वायरमेंट थी वो नहीं पूरी हो सकती थी रूरल एरियाज में. इट वाज नॉट पॉसिबल, एंड ऑब्वियसली फॉर सम अनमैरिड वुमेन इट वाज वेरी मच नीडेड कि वो 20 वीक्स के बाद भी शी इज एबल टू टर्मिनेट हर प्रेगनेंसी बिकॉज ऑफ द सोशल स्टिग्मा अटैच्ड विद इट. सो अब क्या हो गया? द अमेंडमेंट एक्ट हैज इंक्रीज द पीरियड ऑफ टर्मिनेशन ऑफ प्रेगनेंसी. पीरियड को बढ़ा दिया गया है. वो जो टर्मिनेशन ऑफ प्रेगनेंसी वाला पीरियड था उसको बढ़ा दिया गया है. Now pregnancy up to 20 weeks can be terminated with the advice of only one registered medical practitioner. ठीक है? You do not need two medical practitioners now. वो जो 12 weeks वाला क्राइटेरिया था उसको 12 weeks से बढ़ा के 20 weeks कर दिया है. 20 weeks तक सिर्फ एक प्रैक्टिशनर की रिक्वायरमेंट से हो सकता है. And the termination of pregnancy up to 24 weeks can take place with the advice of two registered practitioners. तो get this, जो 12 weeks था उसको 20 वीक्स कर दिया गया है. जो 20 वीक्स था उसको बढ़ाकर 24 वीक्स कर दिया गया है. सो अ प्रेगनेंसी कैन बी टर्मिनेटेड टिल 24 वीक्स. ठीक है, जब तक वो 24 वीक्स की प्रेगनेंसी हो जाती है तब तक इट कैन बी टर्मिनेटेड. द अमेंडमेंट्स आल्सो अलाउड अनमैरिड वुमेन टू टर्मिनेट अ प्रेगनेंसी. ठीक है, अनमैरिड वुमेन हैव आल्सो द राइट टू टर्मिनेट देयर प्रेगनेंसी विद देयर ओन कंसेंट. राइट, इफ शी इज 18 प्लस शी कैन टर्मिनेट हर ओन प्रेगनेंसी. The act says that a pregnancy may be terminated up to 20 weeks in case of failure of contraceptive method or device as well. Okay, so if you go and tell that we use certain protection and it was a failure, the protection did not protect us basically, right? In that case, pregnancy may be terminated up to 20 weeks also. ठीक है, उस केस में भी 20 weeks तक you can get your pregnancy terminated, and that is something which the new law has allowed now. है ना, नए लॉ ने इसको अलाउ कर दिया इस बार. ओके, एनी क्वेश्चन सो फार? फील फ्री टू आस्क योर क्वेश्चंस प्लीज. आई होप ये वाले पॉइंटर्स क्लियर होंगे. 12 वीक्स 20 वीक्स दे बीन इंक्रीज नाउ. नोट दिस डाउन एज वेल, इज क्वाइट इंपॉर्टेंट. और ये अभी रिसेंटली अक्टूबर 21 में ही एक तरह से कह सकते हैं कि लॉ बना है ये. ठीक है, इट हैज बीन नोटिफाइड इन अक्टूबर 21 इटसेल्फ. ठीक है, अक्टूबर 21 में ही इसको नोटिफाई किया गया है. कॉन्ट्रासेप्टिव फेलियर अलग से नहीं था लॉ में पहले. ठीक है, 20 वीक्स वाज अर्लियर फॉर माइनर्स. नहीं, जनरल पीपल, नॉट ओनली फॉर माइनर्स, इट वाज फॉर एवरीबडी. 20 वीक्स वाज द मैक्सिमम लिमिट जिसमें आप ले सकते थे. अब 24 वीक्स कर दिया है. ओके, मैरिज में गर्ल्स का 21, बॉयज का 23 हो गया, प्रेगनेंसी में 18+2 है. दिस इज डिफरेंट. देखिए, प्रेगनेंसी इज अ डिफरेंट कॉन्सेप्ट. ओके, सो एक्ट क्या बोलता है, वो सारे स्टेट्स और यूनियन टेरिटरीज को बोलता है दैट दे आर रिक्वायर्ड टू कॉन्स्टिट्यूट अ मेडिकल बोर्ड. ठीक है, उनको मेडिकल बोर्ड कॉन्स्टिट्यूट करना है which will decide if a pregnancy may be terminated after 24 weeks also due to significant abnormalities. देखो, अभी मैंने आपको बताया कि जो 12 वीक्स था उसको बढ़ाकर हमने 20 वीक्स कर दिया विद वन मेडिकल प्रैक्टिशनर. जो 20 वीक्स था उसको विद मेडिकल प्रैक्टिशनर 24 वीक्स कर दिया है. नाउ देयर मे बी सर्टेन एबनॉर्मैलिटीज जो 24 वीक्स प्लस तक भी चली जाए, है ना. जो 24 वीक्स प्लस में जिनको अगर करवाना है, if somebody wants to get their pregnancy terminated even after 24 weeks, right, then there is a medical board that will be constituted in every state and union territory. आप उस मेडिकल बोर्ड में अप्लाई करो एंड दैट बोर्ड विल एक्चुअली फिर फाइनली डिसाइड कि आपकी जो प्रेगनेंसी है दैट कुड नॉट बी टर्मिनेटेड ड्यू टू सिग्निफिकेंट फीटल एबनॉर्मैलिटीज और नॉट, है ना. दे विल डिसाइड कि व्हाई कुड योर प्रेगनेंसी नॉट बी टर्मिनेटेड. So this implies that there is no change provision for terminating pregnancies due to rape that have crossed 24 weeks limit. This old course, that is to writ petition, would still there for such cases, right? So वो बोल रहे हैं कि there is no change provision for terminating pregnancies due to rape that have crossed 24 weeks limit. Okay? So if there is a rape victim, मान लो for example say there is a rape victim and she wants to get her pregnancy terminated, she will have to do it within 24 weeks. Within 24 weeks of the act. Like, obviously the government understands that there are a lot of social stigma attached with it, there is a lot of trauma attached with an offense like this, but still 24 week limit is given. ठीक है, 24 week limit में आपको वो करना ही पड़ेगा. You are required to do that. ठीक है. एक ये प्रॉब्लम है, there is no time frame for the medical board decision within which the board must make its decision. क्योंकि अगर मान लो I've already crossed 24 weeks, right? There is a lady who has already crossed 24 weeks, then she would want a very quick decision from the medical board because she wants to get her pregnancy terminated. It cannot be done at some point after a later point in time. तो अगर मान लो बोर्ड ही अपना डिसीजन देने में महीना भर या 2 महीना लगा देगा, then it will be very late. So it is very important that certain time frame should be recognized for the board also, कि बोर्ड कितने टाइम में अपना डिसीजन देगा फाइनली. ठीक है. हाँ, that is what I'm saying, right? तो बोर्ड का we need a time frame. We need a time frame for board to finally decide the matter within say 15 days या फिर a week or so. 1 या 2 वीक में they will have to finally decide it because ये नहीं दे रखा है नए लॉ में, which is very much required, जो कि काफी ज्यादा required है अभी. Clear so far? So also the medical practitioner cannot reveal the details of a woman whose pregnancy has been terminated. This is also not allowed, है ना. आप उनकी details किसी को नहीं बता सकते हो. It is within her right to privacy. ठीक है. If she says कि I don't want to reveal my information to anybody, आप नहीं बता सकते. Only the person authorized by law is an exception. ठीक है. अगर मान लो कोई ऐसा इंसान है जो लॉ के अंडर जिसको लगता है कि he should know, for example her husband, ठीक है, her husband, and he should know about it, उनको बता सकते हो, otherwise you cannot tell it to anybody. ठीक है. अगर आप बताते हो, if any doctor violates this and he tells to other people about the termination of pregnancy, it will lead to an imprisonment up to 1 year and fine or both. ठीक है. 1 साल तक की सजा आपको मिल सकती है. Another point that is not very clear: unmarried women abortion was illegal before the amendment. Yes, it was. It was illegal. ठीक है. You cannot get it done legally, and there were a lot of formalities also which did not make a lot of sense. ठीक है. The amendment act is unclear if transgender person will be covered under the bill. ठीक है. ये एक और I would say kind of vague चीज है इसमें, which is not clear by the amendment act कि transgender लोग इसमें आएंगे या नहीं आएंगे. Will transgenders be covered in this? So this is something that the government needs to clarify. If transgenders are also covered in this particular act, तो violator जो है, जो मतलब information को leak करेगा एक तरह से, that person will be punished. यहाँ तक क्लियर है? I hope यहाँ तक clear होगा. फिर we can quickly move to some quiz questions if you guys are clear with the MTP Amendment Act. Okay. Let's do some quiz questions now. ठीक है? Let's quickly do some quiz questions and then we'll end it. ज़्यादा questions नहीं है मेरे पास and we'll only cover some questions. Okay, first one. Which state is responsible for highest spending under the PM Employment Generation Program in financial year 21-22? कौन सा स्टेट हाईएस्ट स्पेंडिंग के लिए रिस्पॉन्सिबल है? So the correct answer for this one is Uttar Pradesh. ठीक है, उत्तर प्रदेश has spent the largest amount of money in the प्रधानमंत्री Employment Generation Program 2021. उत्तर प्रदेश. In October 21, a month-long Clean India program was launched to create awareness on the effects of single-use plastic waste. ये प्रोग्राम कहाँ से स्टार्ट हुआ था? Where did this program start? B. People are saying Prayagraj. Correct. The answer for this one is Prayagraj. ठीक है, the program started in Prayagraj, earlier called Allahabad. It started in Prayagraj. It's a month-long program called Clean India program for harmful effects of single-use plastic waste. Who chaired the G20 Extraordinary Leaders Meeting on Afghanistan, which saw virtual participation of PM Narendra Modi? किसने उसको लीड किया था? G20 Extraordinary Leaders Meeting on Afghanistan. Okay. A. Mario Draghi, Vladimir Putin. So the correct answer for this one is Mario Draghi. ठीक है, Mario Draghi actually headed that meeting. So he was the head of the meeting. It was a G20 Extraordinary Leaders Meeting on Afghanistan. Mario Draghi was the head. Mario Draghi is the correct answer. Tagline of the AFC Women's Asian Cup that will be held in 2022 in India itself. इंडिया में ही होगा एशिया कप एक तरह से फुटबॉल का. So the correct answer is our goals for all. ठीक है, C is the correct answer. Our goals for all. Our goals for all is the correct answer for this one. ठीक है, C. Our goals for all is the correct answer. That is the tagline of the next year's Asia Cup for Asian Football Club for Women. Name the organization that recently increased its ambition to deliver climate financing over the development member countries to 100 billion by 2030. Itna this bank will release the funds for climate financing, basically for the betterment of the climate, general weather in the world. So the correct answer is the Asian Development Bank. Okay, it's the ADB. The Asian Development Bank has done this. It's C, Asian Development Bank. Please note kar lena. Giving you more time to note this down. The Asian Development Bank. Who recently got additional charge as the chairperson of the Insolvency and Bankruptcy Board of India? So the correct answer here is Navrang Saini. Okay, C, Navrang Saini is the correct answer. Navrang Saini is the new IBBI chairperson. ठीक है, नवरंग सैनी. Who was recently elected as the chairman of the Indian Bank Association? Indian Bank Association का chairman who was recently elected? The correct answer is Atul Kumar Goel. ठीक है, Atul Kumar Goel. C is the answer. Atul Kumar Goel is the correct answer. Okay, he is the new chairman of the Indian Bank Association. Atul Kumar Goel, note कर लो इनका नाम. Yes. Which country has signed a MOU with the Ministry of Steel to supply coking coal to boost the steel production in India? Steel production के लिए we are trying to import coking coal from this particular country. Which country is this? So the correct answer for this one is Russia. ठीक है, it's Russia. Russia is the country जिसके साथ में हमने MOU किया है to boost our production of steel using the Russian coking coal. Last two questions now. Last two questions. First Indian personality who was recently appointed the chairman of the World Steel Association. The correct answer for this one is Sajjan Jindal. Sajjan Jindal is the World Steel Association के chairman. ठीक है, first Indian ever to get this is Sajjan Jindal. ये note कर लेना please, very important. First ever Indian to recently appointed as the chairman of the World Steel Association. Last question for the day. President of the Indian Weightlifting Federation. It's Sahdev Yadav. Okay. इंडियन वेट लिफ्टिंग फेडरेशन के प्रेसिडेंट इज सहदेव यादव. नोट कर लेना इनका नाम भी. Very important. These are all good, I would say, important appointments that have taken recently. So guys, that is it with respect to the session from my side. I hope MTP clear होगा आप सबको. MTP amendment, don't make any mistakes in that because those questions will be asked in exam or mock test somewhere here and there. Other than that, guys, Keshav Live मेरा code है. You can use this code. You can visit the description box and get 10% off on the Unacademy subscriptions as well. If you're looking to study with us, we're looking to make your CLAT preparation easier with us. You can do that as well. Okay. So that's it from my side. If you guys have any other questions, feel free to ask me before leaving. Okay, thank you so much. Then I think if there are no further questions, then we can just leave and we'll meet again at 6:30 for our criminal law class today. Okay, I'll see you guys again at 6:30. Thank you so much again. Bye.